on to block 2. So remember, if your patient is alert and oriented times 4, we're going to go O, P, Q, R, S, and T. Okay? So remember, O stands for onset. So we're going to ask, what were you doing? So what were you doing when the chief complaint started? Okay? So we're going to use the word chief complaint because whatever our chief complaint is, that's what we want to write there, okay? Or that's what we want to say. So if, for example, we had a patient with chest pain, we would ask, what were you doing when the chest pain started? Then we move on to P. Remember, P stands for provoke. So we're going to ask, what makes that chief complaint better or worse? Okay? So, in instance, if we had chest pain, we would ask my patient, what makes that chest pain better or worse? Because what makes it better is what we want to do for them. What makes it worse is what we don't want to do for them. Q stands for quality, so I want my patient to describe their chief complaint. Now, it's really important that they describe their chief complaint in their own words. We want to know how they're feeling, not how we're feeling, so we don't want to give them words for them to use. Then we're going to look at radiation. So with radiation, you're going to have them point with one finger where that chief complaint is located. For instance, ours is chest pain. So we'll ask them to point where it's located, and then we'll ask them if it travels, and we'll have them show us where. Okay? So first have them point to where the chief complaint is, and then ask them if it travels. And if it does, ask them to where. Have them show you where. So it's really important to ask both of those questions, okay? Then we're going to look at severity. So when we talk about severity, we're looking at 0 to 10. So for instance, again, my chief complaint's chest pain. So 0 would mean that they have 0 pain. 10 would be the worst chest pain they've ever experienced in their life, okay? And then T would stand for time. So I would ask, when did the chief complaint start? It's really important to find out, is this something that was acute? Is this chronic? Did it come on gradually, or was this a sudden onset? Okay. Now, if my patient was ANO 3 or less, then instead of asking OPQRST, I would ask a friend, family, or bystander my A, E, I, O, U tips. Okay, and remember, A stands for alcohol. Okay, so I'm going to ask my family member, bystander, has the patient been drinking? If so, what and how much? Okay. Then I'm going to ask epilepsy. So I'm going to ask, does my patient have a history of seizures? And if they're like, oh, I'm not too sure, then we could describe what a seizure look like. We could look at your patient. Do they have oral trauma? Are they incontinent? Do they possibly pee on themselves or poop on themselves? Because that could also be an indication of postictal state for seizure. Then we're looking at insulin. So is my patient a diabetic? So I want to ask, is my patient a diabetic? And then we need to kind of explore a little bit more. Type 1, type 2, are they insulin dependent? Are they not? How compliant are they with their meds? That's also really important to ask. Then we're going to look at overdose. So is there a possibility that my patient took too much of something? Okay, this could be an over-the-counter overdose. This could be a narcotic overdose. So we want to make sure that we explore both possibilities. Then we're going to look at underdose. So we're going to see for underdose, did my patient maybe not take enough of something? Because we have a lot of patients out there that are very non-compliant with their medications. Then we're going to look at trauma. Okay, so is there a possibility my patient fell, hit their head? Did they have some type of trauma that's causing them to be altered? Then I'm going to also look at infection. So when I look at infection, we're talking sepsis. We're talking an infection that has literally gone into the bloodstream. Then we're going to ask psychosis. Okay, so when we ask this, we're going to ask, does the patient have any kind of maybe depression history, any kind of mental kind of disabilities that we need to be aware of, or disorders? Okay, I don't want to ask, oh, is your patient crazy? We don't want to ask those kinds of things. So we want to make sure, are there any behavioral kind of issues that the patient may have? And you can list them like depression, schizophrenia, so you can clarify. And then the last one we'd ask if the patient's ever had a stroke. And if they say, oh, I'm not too sure, then I would do a stroke assessment. So I would ask my patient to smile. I'm looking for facial droop, have them talk, listen to slurred speech. I would have them close their eyes. I would lift their arms up. And with their eyes closed, I would tell them to keep their arms up when I let go. If one side drops, then we know that side's probably affected by a possible stroke. I would assess grips. So do I have equal grips on both sides? And then it also assesses pushes and pulls on the feet. All right, so after we ask either OPCRST or AIU tips, then we're going to move on to samples. So either way, if they're a learn-oriented times 4 or ANO 3 or less, we're still going to ask sample. So remember, signs and symptoms we're gathering already, okay? So remember, signs are things that we can see or measure, and a symptom is things the patient's telling us. So when we're asking questions, we're getting kind of the symptoms that the patient's been experiencing. A stands for allergies. So remember, we're going to ask the patient if they have any medication allergies, any food allergies, or any environmental allergies. Okay? It's really important that we ask all of those because the patient may have an environmental allergy that you weren't aware of, and that could be the reason why they called 911. Then we're going to look at what kind of current medications is my patient on. So remember, they're going to be current medications, okay? I don't care about medications that they just finished. I'm looking at what are those current medications that you are on. Then I'm going to look at past pertinent medical history. What I like to always ask my patient is just what are your current medical problems, okay? When you ask a patient medical problems, they seem to understand that better. When they hear the word past pertinent medical history, they always think of past, so they go further back. I want to know, what are your current medical problems? If the patient gives you a list of medications, find out why they take these medications. What do you take this medication for? What do you take this medication for? Okay. Then I'm going to look at L. So I'm going to ask, what was your last oral intake? Now, when we want to ask last oral intake, I'm looking at the last thing they had to eat. So food related was the last thing they had to drink. And did they take any medications? Okay. Because if it's a medication I can assist with, I need to know, have they taken their max dose? Did they only take 81 milligrams of aspirin when I can give 324? So it's really important to have a good idea of, did they take any medications? And if so, how much? So I know how much I can assist that patient with, if any. And then the last one is events leading. So when we talk about events leading to like the current illness that's going on, we're going to ask a question of, has this ever happened before? Okay. And that's a question that's always really hard to remember, but we want to know, has this ever happened before? Because if they say yes, then I'm going to ask them, okay, what happened last time? What did they do for you? If it was helpful, then we may do the exact same treatment. So it's really important to ask, has this happened? Did you call 911? What did they do last time for you? What did the hospital say? Maybe that's when they got a diagnosis of a heart attack, and that's important for us to know. Because then I'm going to have them compare and contrast the last heart attack to how they're feeling now. Then I'm going to move on to clarifying questions, or what I like to say, additional questions. Okay, and these additional questions are going to be questions that I ask my patient that are not part of OPQRST, they're not part of sample, okay, and they weren't even part of my AE/IOU tips if I had to go that route. So I'm going to explore things a little bit more. So let's use our example of our chest pain patient. I'm going to ask my patient, when I notice they have shortness of breath and chest pain, I'm going to ask them, okay, so you have chest pain and shortness of breath. Which came first? Okay, so which came first? Was it the chest pain or was it the shortness of breath? Because a lot of times if our chest pain came first, normally it's more cardiac related, and the shortness of breath came first, it's normally more respiratory. Then I might ask, oh, any increased activity? Because we know sometimes when we overdo it, that could actually cause the shortness of breath or the chest pain. So let's ask, did he have any increased activity? We might want to ask any increased heavy lifting. A lot of people call 911 for chest pain when it's just pretty much muscle related. So I'm going to ask any heavy lifting. So that's important to ask. I might ask my patient as well if they have any nausea or vomiting. A lot of times with your cardiac related patients, they'll have nausea or vomiting. Sometimes just maybe the nausea and maybe or maybe not the vomiting. They may complain of being dizzy. So it's not bad to ask, are you dizzy? Are you lightheaded? Okay, these are all great questions to ask because that's going to pinpoint a little bit more towards cardiac than it would other things. I could ask, maybe they fell. Maybe they hit their chest. So I could ask trauma. Okay, did you fall? Did you hit your chest? I could also ask my patient if they've had any recent illness. Because sometimes when we're ill and we cough for a long time, our chest starts to hurt. Sometimes we've experienced that shortness of breath. So I'm going to say, do you have any recent illness? Do you have a cough? If you do, what color is it? Do you cough anything up? Is it productive? So those are the things I might ask. So I could also ask too if the patient has had any kind of stimulants. So maybe the patient drinks a lot of coffee. Maybe the patient drinks like 5 or 6 energy drinks a day. That would be really important to ask our patient. So that's just a few questions that you can ask. There are a lot more you can ask for clarifying questions. But with our additional clarifying questions, we are trying to rule out things that could be our field impression or rule them in. Okay, so we're going to think of all those things that we talked about in cardiac emergencies, respiratory emergencies, and we're just going to try to rule things in and rule things out. Okay. Then after I ask those clarifying questions, even if I feel like I've asked some for now, maybe I'll go back and ask more later. You can do that before you determine your field impression. But after we get clarifying questions, we're going to move on to assessing the area. Okay, so when I assess the area, remember it's almost like trauma. You're going to expose that area first. So us, it's chest pain. So we're going to expose the chest. We're going to observe it, and then we're going to palpate it. Okay. And again, we're trying to see, can I reproduce that pain? Because if I can reproduce that pain, it's probably not cardiac. If I can't reproduce that pain, then I'm leaning more towards, okay, it could be cardiac, okay? After I assess the area, the very last step of block 2 is to get the rest of my vital signs, okay? So I'm gonna go ahead, and I haven't gotten a blood pressure yet, so let's get a blood pressure of our patient. I also have not assessed pupils yet, so let's get pupils as well. And then last but not least, we're going to get a blood glucose level. Now, for your blood glucose level, you only need to get that if your patient's altered, they have a history of diabetes, or let's say they haven't eaten in a couple days, then I probably get a blood glucose. Now, let's say you put your patient on oxygen and you want to reevaluate that SpO2. Now would be the great time to go ahead and take a look at that SpO2 again and see if there were any changes from the treatment you've provided. And that would be the end of block 2. All right, so I've decided to load and go my patient. So in the back of the ambulance, I would be asking these questions, or as I'm loading up the patient, I would be asking these questions. So we're going to move on to OP-QRST because my patient was alert and oriented times 4. So, sir, what were you doing when this chest pain started?
Watching TV.
Okay, is there anything that makes it better or worse?
The oxygen you gave me.
Okay, that's helping?
Yeah.
Okay. Can you describe this chest pain to me?
Like an elephant sitting on my chest.
Okay. And can you point with one finger where it's located? And does it go anywhere?
It moves to my left shoulder and then up to my jaw.
Okay, all right. And then on a scale of 0 being no pain and 10 being the worst pain you ever felt, what would you rate it?
10 out of 10.
10 out of 10. Okay. And how long ago did this pain start?
About 20 minutes ago.
About 20 minutes ago. Okay. We're getting our signs and symptoms already, but I'm going to ask my patient ample questions. So, sir, are you allergic to any medications?
Not that I know of.
Any food allergies?
No, not that
Any
I know of.
environmental allergies?
No.
No? Okay. What current medications are you taking?
Lisinopril, nitro, and aspirin.
Okay. And then with those medications, what's your past medical history?
I had an MI 2 years ago and high blood pressure.
Okay. And then can you also tell me the last thing that you had to eat?
Hamburger around lunchtime.
Okay, last thing you had to drink?
Water, lemonade.
Okay, and did you take any of your medications today?
Lisinopril and aspirin.
Okay, and both of them this morning?
Yes, ma'am.
Okay, and has this ever happened before?
Yes.
Okay, so last time this happened, did you call 911?
Yes.
Okay, and then what did they do for you?
Took me to the hospital, and I was there for a couple days.
Okay, did they give you any medications or anything that you can remember?
I can't remember.
Like maybe something to chew?
Yeah, they gave me something to chew, definitely.
And what about a spray?
I think under the tongue.
Oh, okay, all right. So, but you went to the hospital, admitted for a couple days.
Yes.
Is that when they told you that you had the heart attack?
Yes.
Okay, all right. All right, sir, so I have a couple more questions to ask you. You said that you have chest pain, and I see that you have shortness of breath. Which came first, that chest pain or shortness of breath?
The chest pain.
The chest pain came first?
Yeah.
Okay. And then any trauma to the chest? Did you fall or anything?
No.
No. Any recent illnesses like cough, fever?
No, only nausea.
Okay, so you've had some nauseous. What about vomiting? Any vomit at all?
No.
Okay, so you've been nauseated but no vomiting.
Yeah.
Okay. Any lightheadedness, dizziness?
Dizziness?
Okay,
Yeah.
so you've been kind of a little dizzy?
Yeah.
Okay.
Definitely.
Any increased activity more than normal?
No.
No?
No.
Any increased stress more than normal?
Nothing too crazy.
No, just kind of the normal
just
stress
normal.
every day?
Yeah.
Okay. Any stimulants like coffee, energy drinks?
No.
Nothing like that?
No.
Okay. All right. So I may ask you a couple other questions, but I think that's all I need for now. So at this point, I'm going to go ahead and I'm going to assess the chest, okay? So I'm going to go ahead and look at it. I'm going to go ahead and palpate it, and then you just let me know if I'm able to reproduce any of the pain, okay?
Okay.
So I'm going to go ahead and push on your chest right now. Okay. There. Push in. Am I able to reproduce it, or does it kind of it's just constant?
It's just constant.
It's just constant.
Yeah.
Okay. So another really good question. So we talked about increased activity, but any like heavy lifting more than normal?
No.
No? Okay. All right. Just want to make sure that there's no muscle strain there. And now I'm going to go ahead and finish up my vitals. Now, because I did put him on oxygen, I'm going to double check that SpO2. So I'm going to put this back on your finger. We're going to see if that increased a little bit, if we need to change that oxygen up a little bit. Sir, I'm going to go ahead and I'm going to shine a light in your eyes. So do me a favor and just look forward. Okay, so I'm going to shine a light in your eye really quick. So I'm going to go ahead and assess his pupils. We got some nice reaction on that side. I'm going to assess this side. All right, so it looks like my pupils are equal, round, and reactive to light. Because my patient doesn't have a history of diabetes, I don't feel the need to get a blood glucose for him, so I'm not going to worry about that. But if my patient had history of diabetes, if they were altered, or if my patient hadn't had anything to eat in a couple days, I might want to double check that. Okay, so sir, I'm going to go ahead and place this on your arm. I'm going to go ahead and get a blood pressure really quick. So we're going to go ahead and put the blood pressure cuff on my patient's arm. I'm going to get my stethoscope back out. And I'm going to go ahead and, just like you guys know, you guys are going to go ahead and get an auscultated blood pressure. So we're going to get that auscultated blood pressure, and we're going to say that his blood pressure comes back at 130/90, okay? So the blood pressure comes back at 130/90. We look at that SpO2 reading on those 10 liters per minute. Oh, we're about 96%. I'm going to probably go up a little bit on the oxygen because I'd like to see it a little bit higher. So I'm going to come over here to our oxygen, and I'm going to increase it. I'm going to go up to 15 liters and see if we can get it up closer to 100% if possible. So, sir, I'm just going to increase that oxygen. We're increasing your oxygen levels, which is great, but we want to get it a little bit higher, okay? And that would be the end of block 2.